Okay, so the first one is actinic keratosis. Um, I don't know if you guys ever heard of this, but um, usually people warn you from going out in the sun too much because you might get skin cancer. Well, this is the stage before that. This is when your skin begins to get damaged. Uh, so, actinic keratosis is a rough, scaly patch on the skin that develops from years of sun exposure. It's often found on the face, lips, ear, forearms, scalp, neck, and back of the hand. These areas are usually what gets exposed to the sun on a normal basis. Um, yeah, forearms. Yep. Um, it's also known as solar keratosis. Um, an actinic keratosis grows slowly and usually first appears in people with over 40 years. So it tends to um, be in older people than younger ones. You can reduce your risk of this skin condition by minimizing your sun exposure and protecting your skin from UV rays. Left untreated, the risk of actinic keratosis turning into a type of skin cancer called aqueous cell carcinoma is about 5 to 10%. So this is the disease that um, people usually warn you about when they talk about skin cancer and going out in the sun too much. What happens? What are the Um, symptoms that happen in actinic keratosis? Um, they vary in appearance. Signs and symptoms include rough, dry, or scaly patch of skin, usually less than 1 inch in diameter. Um, Flat to slightly raised patch or bump on the top layer of your skin. In some cases, a hard wart-like surface. Um, Color variation, including pink, red, and brown, as you see in this one and the other one that we just saw when it's red. Um, Flat to slightly raised patch. Oh, I read this. Color variation, including pink or brown, itching, burning, bleeding, or crusting, and that's why it's sometimes not as comfortable as it should be. New patches or bumps on sun-exposed area of the head, neck, hands, and forearms. These are such symptoms of actinic keratosis. Um, when should a person see a doctor? Well, basically, if it's difficult to like see if it's cancerous or not, and your doctor will just distinguish between them. So it's best to have a skin change evaluated by a doctor, especially if a scaly spot or patch persists, grows, or bleeds. So I think to stay on the safe side, actinic keratosis is not it usually goes away. Um, but if it doesn't or it grows or bleeds, there's a high chance that you have skin cancer. So it's good for backup to check out your skin and make sure that there's no problem. Um, what causes this? Well, as we said, frequent um, UV radiation. Um, the two most common types of UV radiation come from the sun and tanning beds. And I don't think any one of you should be doing tanning beds unless you aspire to be a model.
Even then, don't do it.
Yeah, even then, natural is probably better. Um,
Just,
I think
yeah.
like models do it just to control the level of tan. But so like they don't do too much or too less. They put it at the perfect type. Um, Anyone can develop actinic keratosis, but you're at increased rate if you have red or blonde hair and blue or light colored eyes. Honestly, I'm not sure why this is a risk factor, but I would assume it's like genetics. Or what do you guys think? Because
Yeah, fair skin, less melatonin. You're more prone to skin problems if you're in the sun for too long.
yeah, okay. Have a history of a lot of sun exposures or sunburns. Uh, Well, yeah, if you get a sunburn before, the risk of developing actinic keratosis is high. Tend to freckle or burn when exposed to sunlight, are older than 40 years old. Older people usually have more tender skin, so um, that puts you at more risk. Live in a sunny place like Saudi, uh, or you work outdoors. Let's say you're a construction worker. Um, that puts you at more risk of developing actinic keratosis because we're more exposure to the sun, or have a weakened immune system. Okay, why is it dangerous? Why should we be aware of this actinic keratosis? Um, if treated early, you shouldn't be. Um, it can be easily cleared up and removed. If left untreated, some of these spots might progress to aqueous cell carcinoma,
Squamous.
squamous. Oh my goodness. A type of this is as we said, this is a type of cancer. All right, complication as okay. So the only threat that actinic keratosis has, I mean, yeah, is skin cancer. That's the biggest threat, and skin cancer is um, life threatening. So um, unless treated early, unless you treated early and detected early, it can be life threatening. If it gets into the blood, um, it is life threatening. Okay, so you know the cause, you know what causes it, and you know how dangerous it is. So I think it is best safe to develop in preventing um, this condition. And one of the best ways of preventing is removing the causes. The sun is the biggest cause, so limit your time in the sun. That's number one. Especially avoiding time in between 10 a.m. and 2 p.m., which, as we know, is when the sun is at its strongest. وقت الظهر. Um, Another way you could protect yourself from the sun is using sunscreen. I know it's not as common in Saudi, um, but if you use sunscreen, it reduces the UV radiation, so it's really good. Applying a broad spectrum water resistant sunscreen with sun protection factor of at least 30. So limit your time in the sun. Use sunscreen. Um, Cover up. You For extra protection from the sun, wear tightly woven clothes that cover your arms and legs. Also wear a broad brimmed hat, which provides more protection than a baseball cap. Yeah, so those round, you could say no cowboy hats are different, but those round hats that cover your entire head, those are the best because they usually also cover your neck, which also is prone to getting the actinic keratosis. Um, so it's really good to cover up. Avoid tanning beds. As I said before, you should not be using tanning beds. I don't think they have them in Saudi at all, actually. Um, so I don't think you need to be worried about them. Um, Check your skin regularly and report changes to your doctor. So one of the best ways of prevention is being aware and seeing if you being aware of yourself, how much time you put in the sun, and check your skin normally um for these types of diseases in general, not only actinic keratosis. Um, yeah, check your face, neck, ears, and scalp especially, because these are the areas that are more prone to sunlight. Um, Diagnosis. Um, how will your doctor diagnose this? Well, usually what happens is he just looks at your skin, examines your skin, and declares if you have it or not. If not, he can take a sample of the skin and do some skin biopsy, um, and he does some analysis in the lab and determines if you have actinic keratosis or not. Um, Even after treatment for actinic keratosis, your doctor might suggest that you have your skin checked at least once a year for signs of skin cancer. So once you have, it's good to check every now and then for skin cancer after you get actinic keratosis, uh, because you might your actinic keratosis might clear up, but you might have skin cancer underneath. So it's good to check up every now and then. Treatment: actinic keratosis sometimes disappears on its own, but it might return after more sun exposure. It's hard to tell which actinic keratosis will develop into skin cancer, so they're usually removed as a precaution. Um, so yeah, it's um, usually it's good. It's better to remove the actinic keratosis so it doesn't develop into skin cancer, because cancer is pretty dangerous. Um, Types of medication. If you have several actinic keratosis, your doctor might prescribe a medicated cream or gel to remove it. But these creams and gels might have side effects, and it causes redness, scaling, or burning sensation for a few weeks. So it's for if you have several of actinic keratosis. Toses. Um, for more severe cases, um, and to avoid having skin cancer, there's some surgical procedures that they might do. One thing is freezing the actinic keratosis part. Um, can be removed by freezing them with liquid nitrogen. Your doctor applies the substance to the affected area, which causes blistering or peeling. As your skin heals, the damaged cells slow off, allowing new skin to appear. Syrup, syrup, Seriotherapy is the most common treatment. It takes only a few minutes and it can be done in your doctor's office. Side effects may include blisters, scarring, changes in skin texture, infection, and changes in skin color of the affected area. So basically, they just freeze your hand. Scraping. In this procedure, your doctor uses a device called a curate to scrape off damaged cells. So basically, they literally just scrape the damaged parts of your skin. Um, it might be followed by electrosurgery, in which the doctor uses a pencil-shaped instrument to cut and destroy the affected tissue with an electric current. This procedure requires local anesthesia. Side effects may include infections, scarring, changes in skin color of the affected area. Well, infections is mainly because they're of having cuts in your skin. So you can have a viral or bacterial infection because of it. Right. Next slide. Another thing they can do is laser therapy. Um, this technique is um, in- increasingly used to treat actinic keratosis. Your doctor uses an ablative laser to destroy the patch, allowing new skin to appear. Side effects may include scarring, discoloration of the skin. So we used freezing to remove the patch. We used scraping to remove the patch, and now they use laser to remove the patch. Uh, Phytodynamic therapy. Your doctor might apply light sensitive chemical solution to the affected skin and then expose it to a special light that will destroy the actinic keratosis. Side effects might include redness, swelling, and burning sensation. This time they use light to burn off the affected patch.